Hello and welcome to 10 Minutes with Dr. Tysana Jones. I'm your host, Tysana Jones, with MindWorks Collaborative. This series, again, is created to garner sage advice from amazing professionals across the country to help us get an eyewitness account of what special ed looks like from the inside, from parents, teachers, administrators, and professional advocates. So today we are talking autism. We are in Autism Month, and now it's Autism Acceptance Month. Since the 1970s, it was Autism Awareness Month, but no matter what you call it, it's super important that we really have a better understanding of what is autism spectrum disorder. Today, we have Dr. Tracy McKinney, who I met back in our doctoral program on the conference circuit. Being Black and working with autism, we just constantly were in each other's presentations and pushing each other through research. So, Tracy, will you please introduce yourself to our wonderful community?
Yes, hello. I am Dr. Tracy McKinney. I got my PhD from the University of Central Florida, focused on autism. I worked at Georgia State University as a faculty member for 6 years, and currently I am working overseas as a diagnostician for military families.
Fantastic. So that's me. Awesome. Yes, that's so awesome. I did my student teaching in Germany. So I remember just being VOD, and I think I might do that for my next part of my career. So good stuff. Thank you so much for coming. So we're talking early intervention. There are so many numbers as it relates to Black children in autism, us being underdiagnosed. We're constantly being diagnosed for things that are more emotional behavior, but never autism or cognitive disabilities. But autism just kind of is this odd space that many of our kids don't quite get what they need because they're not diagnosed correctly. So let's talk about this. Like, what's going on? What's changed as far as this diagnosis process?
So I think we are, in some communities, diagnosing people more frequently and earlier because more people know the signs, more doctors are aware, more parents are aware, but that's not always the case across the board in all communities, which is problematic. I think in the Black community, a lot of times people listen to other people and say, oh, well, the father will say, I didn't talk till I was 7, or my brother didn't talk till he was 12, or, my cousin, he just sat back in the room. And then when it was time, he went to school and everything was fine. Mm-hmm. But we have to move away from that. Early intervention is key. The earlier you are able to identify and provide intervention, the better the results will be. Research has shown that. So we've got to listen to research, and we've got to move forward and get our kids services that they need sooner rather than later if we want better outcomes. And we do.
And we do. We want our kids to be as independent as possible. That's what I say. I want kids to be as independent as they can be. So that may look different for all of the kids, but I want you to be the highest level that you can possibly be. So, okay, 10 minutes is quick. So let's think of 3 things. We know these early intervention, huge. What are the top 3 things you want our parents and our teachers to know why this early intervention absolutely matters?
Well, I think we know that if you have early intervention, you've got better outcomes. And one thing that I need parents to know is stop looking inward, saying, oh, it's my fault. Oh, I should have done this. Oh, I should have done that. Move from that. Move on, grieve for a hot minute and then move on, because you've got to get those services in motion. Number 2, trust your gut. I've talked to so many parents after the kids have been diagnosed, and they say, oh, I waited so long. I knew, I felt, I thought, but they didn't trust themselves. Mm-hmm. You've got to trust yourselves. And that's a whole nother talk with Black women trusting themselves and listening. So trust your gut. Number 3, once you're in services, be inquisitive, be involved, and be consistent. If your team tells you, hey, these are the things that you need to do to move your kid forward at home, do those things. Don't go back the next week and say, oh, we didn't have time to do that, or we didn't have time to work on that. when your team is helping you and giving you services, ask questions. Well, what does this do? Well, how do I do this? Well, what happens if we change this? And just really be involved.
Yeah. And so I like how you ask, people will give a prescription, but if you don't understand the how and the what,
right,
you're not going to do it. So it really is imperative to ask those questions so that you can actually do what's being asked of you to do. And we have to be able to be okay with asking questions you're not supposed to know, because there's no reason for you to have known before. So it's okay to ask questions, and it's okay to say, I don't know, show me. It's how do you get the person to understand what your needs are in your home, what your needs are with your kids, but asking the questions and taking that time to really push that professional even to understand what your needs are, because they may not understand or care. And so you need to make them understand and care, right, about your kid, because you're the professional. You know your kid. They know exactly. So we got to push that way. Yeah, I really appreciate that for sure. Now I'm thinking about, like, have we gotten any better as far as some of the testing protocols we're using to diagnose our kids?
Well, when we look at what we're using to diagnose the kids, I think doctors are certainly more familiar with it, which is fantastic. They are able to look much earlier. In the past, you had to be older to get diagnosed with autism, and now they're down to, I think, like, I've seen some research where I think it was under 1 kids are being diagnosed. So yes, they're certainly better at diagnosing earlier. But at the same time, I think when you get to school age, some systems are just throwing you under the developmental delay category and not necessarily specifically autism, which I feel like if you have a diagnosis, then you're going to get some services. So a diagnosis is better than, well, I don't know if I want to say that. I won't say any diagnosis is better than no diagnosis, because that's not true. You certainly want to be diagnosed with the correct label. So I think doctors are certainly getting better at identifying and then even referring to developmental pediatricians when they see that there are some red flags. The CDC did a giant push, act early, learn the signs, and provided physicians with lots of information. They blasted information on their website. So there are screeners that parents can do online. So I think there is certainly more information out there. We're certainly doing a better job getting the information out. Now we just need the people to take that information and run with it.
Take it and run with it, right? So we need to get some legs under this information for sure. Just getting it out to our community folks. And hopefully we'll be talking to some other community people about how we're getting information out to the people and how do we make sure that our kids are actually getting what they need in schools and in their community spaces. So thank you so much. So top 3, give them to me one more time. We can run them down. Trust your gut.
The top 3, trust your gut, be involved, inquisitive, and know that autism is not about you, parent. Move past that.
Absolutely. Thank you so much. Thank you so much. I really appreciate you. You're headed off to work now because you're
I am. I'm overseas in Okinawa, Japan.
Awesome. Thank you so very much. I hope to have you on again.
Thank you for having me.
For sure. And another piece of my work is mindfulness. So we'll have to come back and spend some time on some mindfulness and some yoga practices and get you.
Absolutely.
All right.
Yeah, I just finished my meditation this morning. So yes.
Yes. Thank you so much. And I will see you soon. Thank you, Tracy.
Okay. Take care. Thank you. Bye.